You want to terminate my pregnancy?
You are at great risk.
Have an abortion?
It is not an abortion.
I don't care what you call it. I'm not going to let you come near me or my baby.
Brooke, you heard what Dr. Cadena
He doesn't
said.
know what he's talking about. Don't you think I know what's going on inside of me?
Your sonogram...
It was wrong, all right? I don't know what you saw. You saw a shadow. You saw a blip. You wouldn't let me see it. But there's nothing wrong with my baby. It's just stress, all right? You don't know what I have been through. Tell him.
Brooke.
Tell him what Tad did to me.
Please, try to listen to what the doctor's saying to you.
I have been through hell, all right? It's just, I'm run down in this pain and this cramping. You said it, Tom. You said it. It's just my body's way of telling me that I should slow down, and that's what I will do. I will slow down, all right? I will come to a screeching halt. I will do whatever you tell me to do to take care of this baby. Whatever it is.
Brooke.
It doesn't...
Brooke, with the tubal pregnancy, external factors are not a consideration. All the bed rest in the world will not change the outcome. The fetus is not viable. Its chances of survival are nil.
Well, my baby is alive now, isn't it?
It's very difficult to say.
Well, maybe for you it is, but it's not for me, all right? You know, I know that there is a life growing inside of me, and I don't think it's fair just because I've been under some pressure that you want to cut me open and take this baby. Now, I want a second opinion. I want to talk to another doctor,
Look,
all right?
I will arrange that for you. But they will make the same recommendation. You must terminate this pregnancy as quickly as possible.
Dr. Cadena, just tell me, how critical a condition are we talking about here?
Based on the sonogram and Brooke's description of her symptoms, I think we caught it early.
If we do nothing?
Eventually, the affected fallopian tube could rupture. Hemorrhaging could result. Without surgery, Brooke could go into shock. She could die.
Surgery is the only option?
Yes. First, we do a test called choledocentesis to determine the actual extent of the bleeding. That is followed by the actual removal of that section of the fallopian tube with the fetus.
Remove the fetus? No, you don't understand. I'm not losing this baby.
Brooke, the doctors explained that with or without this procedure, the baby will not survive. We're talking about your life right now.
I don't care. Taking this baby is out of the question, and I refuse to discuss it.
Brooke, it's very late. You had shattering news. To make this decision...
The decision is made. I am keeping this baby.
Let me check you into the hospital while we wait for the second opinion.
No, there's no point to do that. I am fine. There's nothing wrong with me. I remember when I was pregnant with Jamie, you know, I thought Tad was dead, and I remember I drove myself crazy. I kept debating back and forth whether I should tell his family about the baby, and I remember that I had these pre-labor pains then.
These are not pre-labor pains.
It's exactly the same thing, all right? It's just that I have been run down, and I have been letting anxiety get to me, and I know now how I have to handle it. I know, because I knew what to do with Jamie, and it's going to be exactly the same with this baby. I just have to rest. I just have to take it easy, and you know, and everything will be fine. That's...
Brooke, you're putting your life at risk.
I'm fine. You know, I don't know what it is with you doctors. You think you're God? You think you can just take away a life like that? I don't know what they teach you in medical school these days. I should report you to the AMA. I should sue you. You think, what is it? It's a little something, a little, and you have to make a big deal out of it? Is that what they teach you? That you have to take the easy way out?
Brooke, I don't know how to make it any clearer to you. If we allow your pregnancy to progress, your fallopian tube will burst. There will be no baby.
Stop saying that. I'm not gonna... There is a baby growing inside me, all right? I know that. And if you're not going to help me, then I will find a doctor who will help me. Tom, take me home, okay?
Dr. Kadami, can my wife and I have a word alone with Brooke? Is that possible?
Don't start.
Will you please listen to us for just a minute?
Oh, can you believe what he is saying to me? First of all, he's a quack. He's taking some minor problems and blowing them totally out of proportion.
Brooke, Dr. Kadami is a specialist. He is the best in his field. You told me that. Now, his job is to take care of mother and baby.
A tubal pregnancy is not a temporary condition. It's not going to go away, and it will not reverse.
I know that.
Well,
I know that. The Temple magazine did a whole article about health issues for women. I wrote an infertility story myself. I mean, I know about ectopic pregnancies. They are accompanied by severe bleeding, by fever, by nausea, by severe cramps. I don't have any of that, all right? I had a little spotting. I had a minor twinge. I'm fine. I really am. I'm fine. I just, I was a little upset. I'm really okay.
Brooke, why won't you listen to what Dr. Kadami has to say? Look, he ran the ultrasound. Why would he lie to you about what he saw?
Who knows what he saw on that
please.
machine? Who knows? He didn't let me see it, did he? He turned it off before I got a chance to see it. Why would he do that? Why would he not let me see my own baby? Why?
Because your womb is empty.
That is not true. That cannot be true. And I don't... It's not. It just can't be. No.
Please. Let me talk to Dr. Clayton. Now, he will recommend someone that you can see right now. Listen, someone you can see tonight. And I know that's not going to make you feel any better. But at least you will know for certain. Please, sweetheart, please. Your life is in danger. Do this. Please, for me.
No baby, no birthday? How can you ask me to do this?
Has the pain passed? Brooke, you know that we're both on your side. Don't you know that? We just want you to look after yourself.
Nobody else will do it for me, right? How can I? Dr. Kadami is asking. I mean, is that my only choice?
What choice is that?
How can I bring myself to do what Dr. Kadami is asking? Is that my only choice?
What choice is that?
I told you to go home.
Come on, Brooke, how could I possibly go?
What, did you have your ear pressed to the door?
No, of course not.
I thought that my personal life is private. I guess that's a big mistake, huh?
Worried about the baby.
Oh, fine, all right. That justifies your eavesdropping on a private consultation with my physician,
Look,
I
if you're
guess.
upset, then I apologize. But as far as I'm concerned, I think it's my right to find out what the hell's happening with my own kid.
Oh, right. Exercise your rights. Flex your muscle. You got your hooks into Jamie? Well, this baby's where you cannot get at it. Your rights begin and end with me. So why don't you just get out of the office and get out of my life?
How many times do I have to say it? The baby you're carrying is as much mine as it is yours. Now, there's obviously some kind of problem, or you wouldn't be here this late. And until somebody gives me a correct answer, I am not going anywhere. So why don't you just do us all a favor and tell me, is there something wrong with our baby? Brooke, are we gonna lose it?
Think I ever loved you? You don't care about anyone. You pretend you care about people, but you don't care about anyone except yourself.
True.
It is
And
true,
you know-
Tad. It is true. It's all about you, your rights, your desires, your wants.
Fine. I think we've established how you feel about me. I hurt you badly and you hate my guts for it. Well, that's fine. You know, that's your privilege. There's obviously not much I can do to change your opinion of me.
Much? Try nothing.
Okay. Have it your way, Brooke. Have it any way you like, on any topic you like, except our children. That's where I have an equal say. Now, I find you here at Kadami's office and in the middle of the night getting blood tests with your moral support group, and I can't help wondering why. Now, you won't give me a straight answer, then terrific. I'll find out from my dad. I don't want to play it that way, but if you're not going to be straight with me, if you're going to try to cut me out of it again, I'll do whatever I have to find out what the hell's going on with my baby.
Hey, I'm going to call a timeout here.
Tom, wait. If my mercifully soon-to-be ex-husband wants to know the truth, fine, he can have the truth. It would be worth it just to get rid of him.
I knew it. There is some kind of problem.
I had some spotting earlier. And Dr. Kadami ran some tests, and he informed me that there's nothing to be concerned about.
What about the spotting?
What about it? It was brought on by stress. And the only thing I need is some bed rest and some peace and quiet. That's the remedy.
So the baby's not in any danger?
No, except from you, dogging me all the time and pelting me with questions. I think that the cure is simple. Why don't you take a hike and not call me in the morning? Better yet, don't call, period.
Brooke?
Tom, please, I can handle this, okay?
What? What? Just tell me, is that really all there is to it?
What, you want more? It's not enough you got me tied up in knots and I had to come in a panic to my doctor's office?
No. Okay, I'm sorry. Look, I know that you don't want to hear this right now from me, but if there's anything I can do, then please just...
You're hazardous to my health, Tad. You know, you cut yourself out of my life and left me alone to sweat it. Crying jags, panic attacks. But I got through it because I had Jamie. He was my lifeline. And so you took him away from me. And now you're trying to insinuate yourself in this baby's life? Well, it doesn't take a genius to figure out why.
I'm the father.
Oh, la-di-da. You're the father. You know, I have a news flash for you, Daddy. You don't have any idea how much I have invested in these two children. I'm the one. 9 months ahead of time, I have to worry whether the child is going to be healthy. I have to concern myself if I've done everything, that this pregnancy is going to be a safe one. I have a life growing inside me. I'm responsible for it, not you, not Dr. Kadami. You know, so on the day that you make the intruder for conceiving and having a child, then you can talk to me. In the meantime, I think you should go home and practice what you preach and take care of the child that you took away from me. In the meantime, just know that mother and child are doing just fine. Brooke, I don't want to hear it. I did what had to be done.
Dr. Kadami is about to perform surgery that is necessary to save your life. You have to tell Tad about that.
I don't have to tell Tad anything.
Brooke, you have a tubal pregnancy. Sooner or later, Tad is going to find out that the fetus is not viable.
Isn't it? I don't know that. I don't know that at all.